So my case study was about hepatitis B. So for my case study, the data presented to me was the following. A report was sent to the Washington State Health Department about an incident at a nursing home. In this nursing home, 5 of the residents showed signs of anorexia, nausea, and vomiting. Blood work was also taken from the residents, and there was a presence of hepatitis B surface antigen and hepatitis B core antigen in their serum. After reviewing the evidence, the risk factor with the highest relative risk was nurse A. The signs displayed by the nursing home residents, along with the presence of the antigens in the blood, suggested that nurse A was the source. It is possible that nurse A was positive for hepatitis B, or that she transmitted the virus to the patients through their treatment. So next is the disease and pathogens. In the review of the natural history of hepatitis B, Bush and Times stated that hepatitis B currently remains a global health problem that affects more than 240,000 people today. The evolutionary origin of the hepatitis B virus was traced by the analysis of the avian hepatinavirus DNA in the genome of zebra finches. In humans, the virus was first isolated through the laparoscopic biopsy of a Korean mummy in the 16th century. Gerlich also reviewed the recent history of the hepatitis B virus. Baruch Bloomberg was an American physician and a Nobel Peace Prize winner in 1976. He developed the Australian antigen by hypothesizing that people who received blood products from a large amount of donors would develop antibodies against polymorphic serum proteins. His co-worker Harvey Alter eventually discovered a new antigen, and they named it the Australian antigen after the large amounts of samples taken from Australian Aborigines. The Australian antigen later became known as the hepatitis B surface antigen. Today, the World Health Organization states that the highest prevalence of the disease is located in Africa, and as you can see by the figure here, Central and West Africa are the ones most affected. Um, so in this area, 6.1% of adults are infected, and West Asia is also affected, where 6.2% of the adults are infected. The hepatitis B virus is a member of the Hepatinaviride family again. Um, it is small and spherical and is a DNA virus. The size of the virus is usually around 42 nanometers. So here's the structure of the virus. On the outer portion of the virus structure are the large and small hepatitis B surface antigens. Again, these surface antigens were present in the resident serum in the case study. The green markers represent the hepatitis B E antigen, or the early antigens. So going towards the center, the next antigen shown as a pink ring is the hepatitis B core antigen. And since hepatitis B virus is a DNA virus, located in the inner portion of the cell is its DNA. Necessary for replication, of course, you need a DNA polymerase, so that's located right here in yellow. And these features allow it to continue to replicate in an infected cell. So here is the hepatitis B life cycle. So Gerlich again provided an image regarding the life cycle of the hepatitis B virus. He explained that, like its name suggests, the hepatitis B virus targets the hepatocytes, or the liver cells. Hepatitis B starts its infection of a hepatocyte by binding to a receptor, and the virus is engulfed by the cell through endocytosis. So once it enters, it uncoats and enters the nucleus. The viral DNA, or the cccDNA, also known as the covalently closed circular DNA, is used as a template for transcription. Once transcribed, the mRNA enters the cytoplasm unspliced, so it's not fixed or anything like that. Two proteins from the transcription or after being transcribed, undergo translation in the endoplasmic reticulum, and when they arrive at the endoplasmic reticulum, they assemble as hepatitis B surface antigen particles and are secreted via the Golgi apparatus. Pregenomic mRNA undergoes translation in the cytoplasm with the HBV, or the hepatitis B virus core protein, and the viral polymerase. These premature core particles mature via reverse transcription, which they return from mRNA to DNA. So since they're immature, that's how they mature, through reverse transcription. The process is repeated until mature core particles are achieved, and after translation, the virus is replicated and exits the cells. Hepatitis B is a non-cytopathic virus, so meaning that it doesn't kill the cell, but how it's damaged is because once the virus has entered the cell, cytokines detect the infected cell and signal the T lymphocytes to destroy the cell. So when T lymphocytes detect and destroy the cell, they destroy the hepatocyte along with it. The Center for Disease Control mentions that hepatitis B is transmitted through percutaneous and mucosal contact of blood and bodily fluids. The method of transmission of the hepatitis B virus is through the blood, bodily fluids, needles, sexual contact, and pregnancy. So one of the best methods of prevention is through vaccination. Ever since its introduction in the 1980s, the number of cases per year in the United States has decreased from 300,000 to 60,000. Careful handling of sharps, such as in the medical setting, can also prevent the spread of hepatitis B. Education and awareness is also important to those who are high risk. So this is also important in preventing the disease and the spread of the disease. So again, here's my data for the case study. So data was collected from the nursing home that was reported to the Washington State Health Department. Those who were exposed and ill were tallied in the A column according to their associated risk factor. So right in this first column right here. Those who were exposed but not ill were tallied in column B, and residents who were ill but not exposed were placed in column C. And those who were not ill and not exposed were placed in column D. The E value was taken by dividing column A over A plus B, and the F value was taken by dividing column C over C plus D. Relative risk was calculated by dividing the E value from the F value, and the risk factors involved were fingerstick values greater than or equal to 60 MON, fingerstick values less than 60 MON, residents treated by nurse A, B, or D. So after calculating all the risk factors, the risk factor with the largest value was residents that were receiving treatment from nurse A. When compared to the other risk factors, treatment from nurse A was significantly larger than the rest. So as you can see, it's at 63.68. These results indicate that nurse A was the source of the outbreak. So similar outbreaks. Another similar outbreak of hepatitis B happened in Texas in 2008, where Yenlik A. Zitayeva and her colleagues focused on 10 long-term care facilities after 2 infected residents at one of the facilities were reported to the local health department. After 2 years of collecting serological data, 21 out of the 236 residents were infected with hepatitis B. Genomic sequencing of the hepatitis B virus showed 99% homology, so all the viruses, or all the infected patients, had a similar hepatitis B virus. So this suggested that transmission could have occurred throughout the facilities, or in between the facilities. One common theme about the facilities, shown in table 1 or over here, was that one of the agencies, particularly Agency A, provided nurses to all the facilities for diabetic care. These nurses reported that residents in the facility shared a single reuse fingerstick device that was designed for single use only. So Zereyeva recommended that providers, as a result of the outbreak, that the providers and staff of the agencies and facilities become more aware of the infection prevention measures, such as like disposing needles properly and making sure they don't share. She also recommended that the agencies implement regular training intervals for diabetic care and vaccinations for the residents. Another similar outbreak was reported by the Center for Disease Control in their Morbidity and Mortality Weekly Report. In this report, in 1994, the CDC identified hemodialysis centers that failed to isolate patients with hepatitis B during treatments. In one of the hemodialysis centers, they did a cohort study that calculated the relative risk, which showed that in one of the shifts, a heparin vial was reused. So one of the patients receiving treatment at one of the stations was infected with hepatitis B, and all the patients receiving treatments at the same station were infected because they shared the same heparin vial as the patient that already had hepatitis B. So diagnosis and treatments. Many of the signs and symptoms associated with hepatitis B are associated with the flu, so flu-like symptoms. The Mayo Clinic lists these signs and symptoms as nausea and vomiting, as seen in the case study, weakness, fatigue, and jaundice. So jaundice is a yellowing of the skin or sclera, and it occurs because the liver is responsible for controlling bilirubin levels. And since hepatocytes become damaged, the liver is unable to filter the bilirubin, causing the yellow discoloration, so it's unable to filter it. However, hepatitis B is also known as a silent epidemic, since many of the infected are asymptomatic or do not show any signs and symptoms. The Mayo Clinic also lists two stages of hepatitis B, which can be either acute or chronic. Acute hepatitis B usually lasts for months or a few months, less than 6 months, due to the body's immune system fighting off the infection. If the disease lasts more than 6 months, it is considered chronic, and chronic hepatitis B can lead to further complications such as liver cancer or liver cirrhosis. So, a way to diagnose is through the hepatitis B panel, which is seen here, and it's provided by the Hepatitis B Foundation. So the hepatitis B panel gives information about the results of the hepatitis B blood test. 3 markers are identified, and they are the hepatitis B surface antigen, the hepatitis B surface antibody, and the hepatitis B core antibody. The hepatitis B surface antigen indicates that the virus is present, and the presence of the 2 other antibodies show if the person has recovered, is vaccinated, or needs further testing. Other tests include alanine aminotransferase test, or ALT for short, which tests the infection if the infection is found in the liver. And also image testing can be done, which monitors the amount of damage the liver has received. According to the Mayo Clinic, treatment for acute hepatitis B include rest and fluids. And for more serious cases, antiviral medications can be given. So for chronic cases, antiviral medications is a must, and these medications usually end in the letters VIR, such as entecavir and tenofovir. So if there's also like severe damage to the liver, liver transplant may be necessary. So one trend that is one emerging trend in the treatment of hepatitis B is an accelerated vaccination schedule. So in her article from the Journal of Clinical and Translational Hepatology, Stacy stated that 23% of prisoners in Central and West Africa have hepatitis B, and if you remember from the beginning that Western and Central Africa were some of the most hardest hit parts of the world when it comes to hepatitis B. So she reviewed a previous study by Van Herk, who tested an accelerated vaccination schedule, and results from his test led to faster development of the hepatitis B antibodies. So she proposed that a vaccination program based on this schedule should be applied to all prisoners, especially those, again, in Central and West Africa. This schedule involves the initial vaccination with a follow-up vaccination after months 1, 2, and 12. So they get their initial vaccination, and after 1 month, they get their second vaccination, and after another month, they get another one, and then in 10 months, they get their last vaccination. So Stacy believes that this would offer short-term protection for the prisoners, and that research on the long-term effects are necessary. So further studies would be necessary. Currently, her and her colleagues are working with the Ministry of Health in Italy on a pilot study in prisons in Tuscany, Italy. So the summation of my case study: the hepatitis B virus targets and attacks liver cells through replication again. The virus spreads through blood, bodily fluids, and infected sharps. Outbreaks usually occur when there is improper infection control. So again, like the hemodialysis center, they reuse needles. For the nursing home in Texas, they some of the residents reuse their diabetic finger stick needle. And for my case study, uh, the treatment of Nurse A caused them to have an outbreak. And again, hepatitis B is treated with resin fluids and antiviral medications. And vaccinations and awareness should be given to those at risk to help prevent the infection. Thank you.